Hi, everyone. My name is Eytan Stein. I'm an attending physician on the Leukemia Service at Memorial Sloan Kettering Cancer Center. I also direct the program for drug development in leukemia, where we get to investigate new and exciting drugs that may help improve the outcomes of patients with AML. The first study I wanted to talk about was a study of a drug called Tamibarotene, also known as SY1425, in combination with azacitidine and venetoclax. This is really exciting because, as many of you know, azacitidine and venetoclax is the new standard of care for older patients with acute myeloid leukemia. But we know that there are certain patients with acute myeloid leukemia that, for various reasons, may not respond well to azacitidine and venetoclax. SY1425, or tamibarotene, is a compound that targets a special abnormality that occurs in about 30% of patients with AML, called having a RARA super enhancer. What it's called is less important than knowing that 30% of patients have it, and it seems to correlate with not having a good response to azacitidine and venetoclax. So what this trial is doing is it's investigating the combination of tamibarotene in combination with azacitidine and venetoclax, with the hope that it will improve the outcomes for those patients that may not respond to azacitidine and venetoclax alone. We have a poster here at this year's European Hematology Association meeting in beautiful Vienna, Austria, where we are investigating the combination of a drug called LANRA with a drug called gilteritinib. Why are we doing this? We're doing this because we know that patients can have mutations in FLT3. We know that patients with AML can have mutations in a gene called NPM1. What we don't know is whether there are two drugs that can be given together to target patients with both of these mutations. In patients that have a FLT3 mutation, the standard of care is to give gilteritinib, but what if you also have an NPM1 mutation? How are you going to target that mutation also? And what we're doing in this study is we're using this drug LANRA in combination with gilteritinib to try to target both mutations at once. And we're hoping that by targeting both mutations at once, that will lead to better outcomes than just targeting one mutation alone.